Welcome to Imaging Alaska. My name is Ward Hinger. I'm the Chief Administrative Officer for Alaska Radiology Associates. I'm also the CEO for Imaging Associates. Alaska Radiology Associates manages Imaging Associates by physicians for physicians. We have three beautiful locations, one in Anchorage, one in Eagle River, and one in the heart of the Mat-Su Valley, right in Palmer. Today, we are blessed to have Laura Ditlinger, who is our Director of Guest Services. Laura, welcome.
Thank you.
How are you doing today?
Good. Great pronunciation of the last name.
Oh, yes. Yes. I like it. Anyhow, Laura is, like I said, the Director of Guest Services for Imaging Associates. And there's a lot of things over the years, Laura, that's made Imaging Associates or moved Imaging Associates from brand awareness to brand preference. Obviously, we have incredible subspecialized radiologists, and we spend millions every year on investing in the equipment that acquires the images to really the perfection that the radiologists need to provide a very awesome subspecialized quality report back to the referring physician, so that referring physician can in turn develop a treatment plan for our shared patient. That is all very, very important, and that has helped tremendously in bringing us to brand preference. But I would like to say that your realm that you oversee at Imaging Associates is equally as important. It really fits into our common purpose, which is to provide our guests a compassionate and exceptional experience. And you're at the heartbeat of that. So, Laura, before we dive into your realm, can you give a little bit of background as to where you're from, when you came to Alaska, and then we'll talk about what drew you to Imaging Associates?
Yeah, I'm from a small town in Indiana, so definitely grew up in the cornfields in a much different environment. Yeah. You're seeing hills for days versus these big jutting mountains, so it's much different. I started up here in 2016 doing summers for tourism, and then I had traveled a bunch, in my early 20s, and finally felt like I was home, which was, odd on the road, and then made the big plunge in 2019, right before COVID in September. So I had a few good months of really getting the Anchorage and, Mat-Su Valley way before a lot of things changed for us.
Yeah, 2020 was an interesting year, to say the least. So you really started off in the hospitality business, is that correct?
Yeah.
And I think that's what drew you possibly to Imaging Associates, is to serve the communities that we're in.
Yeah, I've always had an interest in medical, but 2020 was a pivoting year for a lot of people and companies, and I was a part of that big transition.
Well, we are certainly blessed to have you on board. So how long have you been at Imaging Associates?
So I've been with Imaging Associates since August of 2020. So I'm hitting my 4-year mark, any day now.
Yes. You've been through what I would consider transformational change at Imaging Associates.
Absolutely.
Fortunately for us, we were partnered with the right vendors, that we were making a lot of moves and steps towards integrating the guest, what we call our patients' ability to really do a lot of things online to reduce the amount of time that they actually spend at the imaging centers that we serve with regards to registration, et cetera, just making their experience faster, in and out, quicker, saving them time, and just less time hanging around in a healthcare facility. So what I like to do is just talk about the patient's experience from your perspective, all the things that you do, and let's just break down the different skills that you oversee. Obviously answering the phones, right?
Yeah, we're definitely the first and last impression of every guest, regardless if you're a patient or a physician. So that does start with, taking that incoming phone call.
Right. And there's so many different questions that patients can have. So your staff has to really be well educated as to the different modalities and exams that we provide them. So there's a lot of training that goes in. I would say, 6 months training is what just give a basic initial baseline?
Yeah, absolutely. You're given about 2 weeks to start training, additional if needed, but you really become robust in your skill around that 3 to 6 month mark.
Okay. So I'm a patient and I go to my provider. My provider says, well, there's possibly something going on and we're going to order a CT scan of your brain, right? And what's the next step? What does the healthcare provider then do at that point?
Yeah, they have a couple of options, most efficient being our MD portal. Placing that order within the portal is, a straight through processing approach. You have the option of self-scheduling in there for the patient if they're in the office, or if not, you can still place that order in other fashions as well. They can, fax it, use an EMR if they have one integrated. And then the patient should really receive an alert text message within 10 minutes of that order being uploaded into their chart.
That's fascinating. So we have developed a portal, a web-based portal for providers that they can go out and look at our schedule. They actually have direct access to our schedule. And so they can launch that order right from that portal. And they can also use the EMR, electronic medical record, interfaces with Imaging Associates. So we often support what I call the bilateral or the unidirectional and bidirectional interface, which is HL7 encrypted, which protects the patient's privacy of their information. So that data comes over in a very secured, seamless manner, what we call straight-through processing. At that point in time, once that hits our system, what's the next step in the patient's experience?
Yeah, hopefully they have kind of two options. They can just have that serve as a reminder text message, or there's a link for them to self-schedule as well. So you have a variety of outreach that we're doing that really caters to that individual and that guest. So if they're not super tech savvy, absolutely give us a call. Our phone number will be right there. And then we space out how we're reaching out to you. Just to make sure, people are busy. If it's not the ideal time for you to receive that message, or if you haven't left your physician's office yet, you have that option of an additional reminder until you kind of tell us stop or you schedule.
Awesome. So I actually get a text message as a patient, and in the text message is the opportunity for me to call, or there's a link on the text message that gives me access to the schedule at Imaging Associates.
Yes, very similar to that provider portal. So it serves as a link, and you'll get a series of those as well. They do have a time decay. You want to be also compliant to make sure we're not having these links floating out there that other people could have access to if you share a phone or something of that. So it does have a decay, and you have to put in your birth date with verification on that end too.
That's interesting. So not only do we give the referring physician access to our schedule, but we also give the patient access to our schedule to many of the exams. And so at their own convenience, they can literally select the URL link on the text message, get access to our schedule, and schedule at their own convenience.
Absolutely.
That's great. And that's something recent that Imaging Associates rolled out probably in the last 6-7 months.
Yep. Mm-hmm. We really rolled it out for all modalities in about the last 6 months. We kind of beta tested it on screening mammograms, and we had such success. Why not open it up to all of these other modalities that we offer?
That's great. So I schedule an appointment, and I get confirmation that I have an appointment, and I come into Imaging Associates. What can I expect when I enter into Imaging Associates?
Yeah, you're going to be greeted. First, you're going to pull up and see one of our 3 beautiful sites, and you're going to know where you're at. They're very consistent in their aesthetics, their vibe, and their welcoming greeter that joins you at the front. So our concierge will greet you. You can let them know if you've already pre-registered, hand them your photo ID and insurance cards, and they'll take it from there. If you haven't had a chance to do that yet, they're going to hand you either a handheld kiosk, or they'll direct you to a stand-up one, kind of whatever is more comfortable for that patient.
So you have a wireless tablet that you can give the patient, and they can sit down and finish their registration in ease and comfort.
Yep.
We also have a kiosk if they'd rather stand and just do it on a kiosk themselves. And then we have the more traditional manner for people that just say, you know what, I would just like to have someone, a human being, do this for me. It's easy. So we offer those 3 options to our guests.
Yeah, absolutely. People are coming in, they might not feel well. It might be preventative care, but they might be in pain. So we definitely want to be catering what's the easiest, smoothest check-in for that guest's experience.
Interesting. Now, I have insurance, and there's this process called pre-cert authorization. It sounds like Greek to most patients, right? And most patients don't really get involved in that because their referring physician will do it. But at Imaging Associates, we do it for the patient and their referring physician.
Yeah, you definitely need a Webster's dictionary for insurance terms. Pre-cert authorization, it mostly pertains to MRI and CT exams.
Okay.
For most commercial insurances, you'll have, a slight variance, but we definitely take on that footwork where other facilities in Alaska or the lower 48 might not do that. Your referring office might be held accountable for that, but we're really trying to, again, with that straight through processing, take that off the hands of the patient or the provider to worry about, and they just send the order and they know everything's going to be taken care of from there.
How long does that take?
There's a big variance for commercial authorizations. I'd say it's about 5 5-day turnaround time average, which is awesome. So, you have the possibility of getting your exam within a week of it being ordered or less. Okay. You definitely can sign a customer responsibility form if you prefer. If you want to get this done right now, we're still going to try to obtain that authorization. So you do have that option and that flexibility.
Okay. And so Imogen Associates is contracted with all the major payers. So United, Moda, Premera, Aetna. Did I miss anything for commercial? Those are the big ones?
Yeah, those are the big ones.
And then we also accept Medicaid, Medicare, and TRICARE and VA.
Yep, all of them.
All right. And so each one of those payers requires different avenues for us to get authorization for services. Some take much longer, like I believe the state of Alaska Medicaid is probably the longest. It takes up to maybe 6 weeks.
They do average about 4 to 6 weeks.
Yeah, so that can be frustrating for the patients, but it's out of our hands. We're doing the best we can, and we have amazing technology that expedites all of this that we've invested in. Is that correct?
Yeah, absolutely. Our insurance coordinator are super knowledgeable and robust in their skill in itself. We do to kind of move things along if your insurance doesn't require authorization, instead of a human kind of going through and finding those. We do have some technology that does some of that footwork for us. So you're not waiting around for a human to get to it if your insurance doesn't require authorization anyways.
Thank you for implementing that for us. I know that was a little bit of work, but at the end of the day, the patient wins in all this. So that's interesting. If I don't have insurance and I want to pay at the time of service in full, what does Imogen Associates offer?
Yeah, absolutely. So regardless if you're insured or not insured, we offer this to anyone who chooses to utilize it. We do have a self-paid discount. So that's giving you 60% discount off of that total billed costs, leaving the patient responsible for 40%.
Yeah, that's a significant savings.
Absolutely. Yeah. It's essentially the cost that it takes for us to bill all these claims through insurances and the reimbursement that we may get through those insurances.
A lot of people just don't understand the massive amount of costs associated with dealing with, adjudicating claims with insurance companies and the delay in getting paid. We have a lot of claims that are out there that we've received authorization for that we're waiting 90, 120 days to get paid on. It's called accounts receivable in the world of accounting. But a lot of patients just are, that's invisible to them. They don't see it. A lot of things are invisible to the patients, really.
Yeah, and to a degree, maybe it should be. Kind of giving them this healthcare with a little bit of a rose-colored glass isn't always inherently such a negative thing. We don't want you to be worrying about, you're already worrying about your health and maybe you're worrying about cost. So having these little buffers in place aren't directly negative.
Oh, I don't think they are at all. I think they're wonderful. And we've been very intentional about you put those buffers in place and the rose-colored glasses because we know a lot of patients that are coming to us, they're simply not feeling well. Or they're coming in for a screening mammography or they're coming in for a prostate exam and they simply don't know what they have. Maybe their mom had cancer, their grandmother had cancer, and yeah, there's a lot of anxiety. And our goal at Imogen Associates, and you guys, the wonderful people, the guest services reps, they really do a fantastic job of taking that edge off. And when people come into Imogen Associates, and I've seen this, I stand back and watch your team engage. And so they're very in the moment and intentional as to what our guests see, smell, hear, feel. And we want it to be just a very calming, relaxed environment. And at the same time, we want our guests to feel like they're in the very best professional environment as well, that they've come to the right place for their diagnosis. Let's talk a little bit about our beautiful site in Anchorage. Okay, so what kind of services do we have there? What are the different modalities and exams there? You just want to start going around the circle?
Yeah, we can definitely do that. So, okay. We're going to start, obviously, MRI. We have 2 great MRI machines, 1.5, and we do have an open MRI there currently, which is a really great option for claustrophobic patients or even patients who are just like a little unsettled. So I like to describe that machine more of like a hamburger. It's a lot easier to visualize that way than maybe like a hot dog as like a traditional MRI. So it's definitely better for certain patients that might have some of those kinds of anxieties leading up to it, or someone who's maybe never had an MRI before as well.
You threw out a number, 1.5. I'm not sure what that means, but let's unpack this for our guests. I do know what it means. So MRIs don't use radiation or ultrasound waves to create an image. It uses magnetic field. And so that's the Tesla strength of the magnet. And Anything above a 1 is considered high field
Absolutely.
MRI.
And all of our MRIs are going to provide that, even the open. So we're happy to, give that best service.
We actually have in Alaska, it's only high field open MRI. It's been for years, and we actually purchased that with the veterans in Alaska in mind, because we know a lot of them suffer from PTSD, and they're coming in and they're anxious, and we just want to give them as much comfort as possible without sacrificing the quality of the image. And what's really exciting is that open MRI, we're going to be moving to Eagle River, and so it's going to be a really great access point for people both in the Mat-Su Valley and in Anchorage and in Eagle River. So we're going to kind of spread it around and bring in new technology. We're going to be bringing in a 3 Tesla MRI into Anchorage. This is the most advanced MRI technology in the world, and we're really proud that that's going to be up and running, I'm hoping, on 1st of November. So we talked about MRIs. What's next?
Yeah, to piggyback off of MRIs too, we also offer anti-anxiety, as you were saying. A lot of veterans might have that as well with the claustrophobia. So that's definitely an added courtesy that we provide at both our Anchorage and Palmer site, and soon to be Eagle River. So even if that open's not quite enough reassurance for you, or if you choose to do a traditional MRI, we're happy to offer that anti-anxiety medication as well.
And what's the rules of engagement around that medication? Do I have to show up early? Do I need to have a driver with me? How does that roll?
Yeah, check and check. You definitely need to arrive with a driver, someone who can, care for you and drive home afterwards. And you'll arrive about an hour early.
Okay.
Yeah, your driver doesn't have to stay during the time of your scan. They just have a bit of paperwork to do. If they want to get something else done in that 45 minutes, hour that you'll be with us, they're welcome to, or they can stay. That's totally up to the discretion of your driver.
Certainly. I mean, at all of our sites, there's easy drive time to coffee shops, stuff like that to hang out at. So,
absolutely.
Yeah, great. Okay, so the next modality would be?
We can touch on CT and our PET CT, both really robust programs. Our PET CT is only in Anchorage at this time right now. Most of our doses for those, so those are radioactive doses, are flown in from Seattle daily, with the exception of our PSMA doses, which are created here in Anchorage.
So we have these isotopes that are created in a machine called a cyclotron.
I know it sounds like a transformer.
Yeah, like a transformer. I love that. And so these isotopes are actually put on Alaska Airlines every day, and they come up in the morning. And we schedule the patients in the afternoon for these exams. So it's like a radioactive sugar water that we inject into the patients, and the patients have to have uptake time on this. And right now we can only offer this in Anchorage because those isotopes start breaking down as soon as they're made. And there's just not a lot of lifespan for them to make it to the Mat-Su Valley or outside of Anchorage. So hopefully someday we may have a cyclotron in Alaska, and that would be a game changer for the Mat-Su Valley, because then we could stand up full PET services out there. You mentioned the word PSMA.
Yeah.
Can you unpack that a little bit for us?
Absolutely. So that's going to be our prostate isotope.
Okay.
So this is also newer to Alaska in the last 6 months or a year, maybe?
Yeah, last 6 to 8 months.
Yeah. And so previously patients who had, a cancer more specific to the prostate would have to fly to Seattle to get these this PET scan performed. So bringing that to Alaska has, really improved. There's travel expenses involved, again, with that anxiety, and it hasn't delayed care as much for these patients who need to receive this service.
It's a really great partnership with Alaska Urology Associates, both the MRI and PET. A lot of people don't know that when they're candidates for it, if they have the presenting symptoms, they can be sent over to Imaging Associates for an MRI of their prostate. And then we take that MRI and we send it back to Alaska Urology Associates. They overlay it with an ultrasound, and they can do precise, biopsy of that spot. In the past, they used to do things called like blind biopsies, like they did 20 jabs of the prostate, and that just doesn't feel good to the prostate. So this is really an advanced method, and we were the first to introduce that, and we were the first to introduce the PSMA. And we're always working with vendors, pharmacists, and equipment vendors to bring to Alaska the first and only and the best. So that's really something we can be proud of in serving our communities. And it's been a game changer. I've had friends personally in Alaska that have been recent recipients of the PSMA, and they have just sang us praises. So let's move on. What's the next modality?
Yeah, and then I guess to finish off CT, really robust program in itself as well. Something nice that we do for imaging associates is if maybe your kidneys function, you're not sure where it stands, because you will receive an iodine contrast for some scans. We do that lab in-house. So you don't have to worry about timing of going to, your closest LabQuest or wherever. We'll check those kidney functions, your creatinine levels in-house to make sure you're good to go before we, administer this iodine for you. And then if you might have an iodine allergy, we also have, protocols that our technologists work closely with your referring office to make sure you don't have any reactions moving forward.
You made that sound so easy. I mean, that's very technical. Let's go back a little bit. So contrast, why do we need contrast?
In not doctor's terminology, it just really adds highlight to your body. Mm-hmm. So if we're looking at different specific areas of your body, we kind of want to glow up, those glow in the dark stars you had as a kid. We want to see that inside of you.
Yeah. Yeah, it makes it much better. It's clear imaging. It's better. So sometimes there will be, with or without contrast. It's up to the radiologist, mm-hmm. and they'll select the path that's best for the patient, always. And at Imaging Associates, we've just partnered with a new vendor with regards to contrast to reduce by half the contrast that patients get. So that's something we want to get that out there. Is like we're the first to do that at Imaging Associates. We're always looking for advancing for the best interest of the patient. And those tests, so convenient to have on hand, so they don't have to go to a separate lab to do that. We offer that in-house. Mm-hmm. Our CTs are also the most advanced CT technology in the world. Often producing about 50% less radiation because CTs and X-rays and fluoroscopy, they all use radiation to acquire an image. And the radiation is very minimal. Often you get more radiation flying from here to Seattle and when you're in flight than you do from a standard X-ray. So I just want to let people know that they don't have to be that concerned about the radiation piece of it, but do be conscious over your lifetime how much you have had. So in addition to CT and PET, we have also, let's focus on those modalities that use radiation. We have X-ray.
Yeah, we have X-ray. We see pretty much everything for X-ray. I don't have a whole lot to say about X-ray.
Let's talk. I mean, it seems like the unsung hero, but usually X-ray is the gateway to more advanced imaging. Is that they want to rule out things using X-ray? Yeah,
it is. It's definitely most cost-sensitive option. So before, again, poking and prodding or looking into more in-depth modalities, it's definitely kind of your first stop to see where we need to pivot to, or we being your physician. Is that an MRI or do you need an ultrasound? It can definitely depend on if you're having bony issues or if it's other body structures.
Yeah, that's well said. And X-ray access, I mean, patients can usually walk in same day, next day for X-ray, so we can really get people in and out fast and do some rule outs and determine if more advanced imaging is needed. Let's discuss fluoroscopy.
Yeah.
Okay, that's really an interesting modality, isn't it?
So that's where you really meet the face of a radiologist. For most patients, probably the first time. A lot of the other ones, they're reading your scans, they're getting, those quality images dictated into your physicians. But that's the first time a patient potentially could come face to face with a radiologist.
That's a great point. And a lot of people don't understand that our radiologists are very heavy proceduralists. I mean, they do a lot of procedures, which I'm going to ask you to talk about in a few seconds. So usually the radiologist is overseeing the technologist as acquiring the MRI or the PET, and they're on the phone with our patient's provider, explaining the exam and working with our patients, our guests, healthcare partner in developing a treatment plan. So the patients aren't really directly exposed to our radiologists all the time, but in this modality, they are. Absolutely. So the radiologist, interventional radiologist, or some radiologists with heavy procedure experience will come in and they'll be wearing a lead apron, right? Mm-hmm. And then we have a machine that looks like a C, and the patient lays in the C, and the patient's protected with the appropriate lead aprons as well to minimize radiation exposure. And they're able to look at the body and able to dispense medication or contrast exactly where it's needed to help the patient. What are some of the procedures that we do?
Yeah, absolutely. So we do have, a couple pain injections, like your transformal or like cortisol injections. We'll provide that to you. We also do a really neat kind of away from the MSK type stuff. We have a neuro.
MSK stands for musculoskeletal?
Yeah.
I got that one
you
right.
did.
I'm so smart.
We have some neuro ones too. So we do have the sphenocath, which is, patients who have chronic migraines for whatever reason. Patients find significant, almost immediate relief.
I didn't realize how many people in Alaska suffer from migraines.
Yeah.
Does this have something to do because we're so far north, like next to the North Pole, Santa Claus land? What's going on there?
I don't know if there's pressure in the air. Ask Dr. York. We should find out more.
We need to get Dr. York, our awesome, smart neuroradiologist on this one. But so for patients that are suffering from migraines, and migraines can be debilitating big time, it's best if they come in with the conditions presenting. Is that true?
Yeah, it's definitely helpful. It's not a requirement, but it's definitely helpful. They'll kind of shoot up into your nasal bones, for lack of better terms, to really flush out those. I believe it's the nerves that are kind of on the fritz a little bit that are causing that friction that creates that migraine.
We've got a good video on our internet, right, that explains all this procedure. So really want to encourage people that if you're suffering from migraines, we do have the sphenocath procedure that's available, and it's pretty high success rate.
It is.
You may have to come back more than once. Is that true?
You may, not super common, but definitely it happens for some people depending on the severity of their migraines.
Great. And it can get you off the drugs, drug-free. That's beautiful. What's next? What else on the floral? You mentioned some other pain management and then arthrograms, stuff like that.
Yeah.
Can you explain that?
So arthrograms kind of work hand in hand with our MRI. So if you have a specific, maybe you're looking for a tear or a very specific joint in mind, it directly injects contrast to that joint. So maybe it's your shoulder or your knee or even hip pain. And you'll start to see that contrast, if you were to look at it on that image, kind of pool and collect into that joint versus getting it, through an IV that some people might be more familiar with.
Awesome. We'll move around the circle here, and then we have a Breast Imaging Center of Excellence, which is a special designation by the American College of Radiology. Our medical director, Dr. Osteen, who happens to be fellowship trained in breast imaging, oversees this entire program. I think we have now 4 breast radiologists that participate at our different sites. So that Breast Imaging Center of Excellence uses both 3D tomography, which uses low radiation dosage to acquire the very best image. And we're really proud. Hologic is the vendor that sells us the equipment and the software. They're really the only game globally. I'm not sure if you knew that. And I've been partnered with them for many years in my healthcare career. And they're very proud to say that we are leveraging their most advanced hardware and software in the world. And very few people, very few organizations in the lower 48 are actually doing that. So I really am proud of our Breast Imaging Center of Excellence, of what we're providing, the level of quality of imaging that we're providing in Alaska that's unmatched anywhere. We then, for the Breast Imaging Center of Excellence, we use the MRI modality when necessary for breast scans down there. And then we also use ultrasound sonography. You want to talk about sonography a little bit?
Yeah, sonography is also a super I don't have another word other than robust. It's such a broad area, and our techs have definitely, refined that expertise that they have to have for these different kind of body scans. So, breast imaging, they'll see for different, maybe women have dense breasts. They'll have their mammogram and then come to ultrasound for that as well. And then we have a couple with MRI and our tomo biopsies. We do biopsies under ultrasound as well. And not just for breast imaging, but thyroid, fine needle aspirations, biopsying that using a specialized lab that we send those results to specific to thyroid testing.
Exactly.
So we are happy to start you getting your thyroid scanned. And then if you do need to get called back for a biopsy of that, which we see pretty, regularly, or people need to have this scan completed every other year sometimes, depending on their own history. We see quite a few of those come through all of our, we can actually perform that in Eagle River too. So each location, as long as there's a radiologist there who can assist in that. Some of the other things we're doing under ultrasound is We have our vein clinic downstairs in Anchorage. So
Premier Vein of Alaska.
Yeah.
That's a doing business as, because they really fall underneath Imaging Associates, but they have such a unique service line. We wanted to pull that out. Is that correct?
Absolutely.
Awesome.
Yeah. And so ultrasound is really helpful with that as well. Getting reflex studies visualized, these venous and arterial exams, not just for Premier Vein of Alaska, but it's super, one-stop shop, send them up on their way to make sure before we get started on, a procedure, we want to see what's going on in there from, the ultrasound level first.
And those are called reflex studies?
Yeah.
Yeah. Amazing technology. Well, thank you, Laura. I mean, you and your team oversee those modalities, those various, and we just touched on it. A few of the many exams that we offer.
Yeah, it's definitely skimming the surface.
It's skimming the surface. How many, just scientific wild ass guess, what would you imagine our total number of exams that we offer? I've seen the order sheet, and it's like gone from one sheet to 2 sheets. I think we're now on 3.
It's long.
It's long.
I don't know if I'm a betting man on that one. It's long. It's extensive.
Very extensive. Yeah, we really pride ourselves in being a true subspecialty diagnostic outpatient preference for physicians and our shared patients. So I come in, and I'm not aware of all the technology that Imaging Associates has put in place, and the massive amount of investment and the training to go with that and the maintenance to go with that. I come in and I'm provided this exceptional experience and just what I like to call spa-like experience, and just very relaxing and calming. And I end up leaving, and as soon as I walk out the door, I'll get a text message.
You will.
Yeah.
We want to know how that experience was.
We do. And there's one question that's really important to me. Only one question. Would you refer your family or friends to Imaging Associates? Yes or no? Because their answer means everything.
Absolutely.
And every no answer comes directly to me, right?
It does, yeah.
on design.
We look into it, we investigate it. We really want to find out the root of that. Sometimes patients are, oops, click the wrong button.
Most of the time, that's true. Yeah, that's most
which is nice and reassuring to hear. But we're always going to do that touch base with that patient to find out if it was an oops or not. But there's a lot of things that we can learn from in those no answers.
Absolutely.
So engaging that conversation with the patient and letting them know that this little minimal feedback isn't going on deaf ears.
Immediate service recovery is very, very important at Imaging Associates. And you and your team, Laura, are just at the heartbeat of that. It's really cool. And you laid it out so wonderfully. We're big believers in getting constructive feedback from our customers, our referring physicians and our patients, and in this case, our patients, and then doing an immediate service recovery and then going back with your team. And you have a very young team, but very bright.
We do.
And they understand continued process improvement. And we dig into finding out, like you said, the root cause analysis, because most of the times when a business or service creates an issue, it's usually process driven, that we can go back and look at the process. You've mapped out all your workflow internally. I don't know how many Visio workflow sheets you have, but it's always moving. It's a living document, and we continually update that based upon feedback internally and externally. So I like to say like 99% are saying yes, absolutely. And that 1% that I get no, we often find valuable input and constructive feedback to continue to improve our processes and services.
Absolutely. And I have a team of about, it's about 50 right now.
50 people?
50.
How do you manage 50 people?
I have some really great leads and I have a great manager, divide and conquering. But with that, and speaking of how many services we do perform, there will be a learning curve for, any new guest representative coming in. So we want to be able to, show them this problem that didn't happen a week ago. It happened right now, and really address it with you right now and how we can move forward. Or the best experience for the patient, and then also the best experience for the guest service rep. Make sure they're getting that job satisfaction, seeing how they can help more patients in Alaska.
That's great. And you've done a great job mentoring your team, Laura, very impressed. And what I've seen also, we obviously have, people, maybe a third of our staff that is still in that training process. They are really coached well to know when to elevate a concern of our patients to what we call a lead. And our lead has a lot of experience. So quickly, if they see a red flag saying, you know what, I'm out of my realm, I'm going to bump this up to a lead who is very experienced and can walk our patient through a solution. I want to thank you for putting that all together. So is there anything that we didn't touch on, Laura, that you think is important for our patients or guests to know about?
Not necessarily. I guess circling back to the our portal and our self-scheduling, just a special shout out is that it's not currently available to schedule breast procedures.
Sure. Because that's very complicated.
It's super complicated. Yeah. We want to make sure we have all of your prior imaging, and then you're not resulted in a reschedule or something of that nature. So that's something that's not available in self-scheduling currently. But, our portal, once you get everything you're seeing and everything is still on our portal. So it's very, nice. You have, access to your records 24/7. That's
really great. So images and reports are all there. All your information is there. And again, we accept all insurances and we provide estimates to the patient as to what their out-of-pocket will be.
Yeah, absolutely.
And what drives that out-of-pocket? I know. There's a good one. It wasn't a trick question.
Yeah. So, kind of back to our flashcards of insurance terms. So your out of pocket is how much you will owe your insurance.
Sure.
And well, I guess to back up your deductible, you need to pay off your deductible.
Okay.
And they'll cover at 100% once it gets paid off.
Okay.
If you haven't made your out of pocket, then you'll have this slight co-insurance or co-pay until your insurance again starts paying at 100%.
Yeah. So, and again, insurance is a very, there's many different insurance programs and there's many different plans underneath each insurance. And we're linked to those insurance entities through a software program. So we can actually see how much of a patient's deductible has been paid, if it was all or some, and we can give to the patient with pretty high probability what their out-of-pocket will be at the time of the exam. Is that correct?
Yeah, absolutely. And if you have questions over that that estimate, we always want you to bring those questions to us before you start signing something. Yeah. If something doesn't look quite right, if we need to hop back on there, maybe you've had a lot of appointments recently, we're going to constantly try to rerun that number to give this most accurate representation of where you're at in meeting your deductible and your out-of-pocket.
Because our interface with these insurance companies aren't always like 100% real time. There's maybe a 2 or 3 day lag. So if you've been to a provider yesterday, that may have not yet worked through the system yet.
Yep. And that's kind of us, really relying on those insurances to make sure they're processing their claims as fast as they possibly can so that we can provide you the best estimate possible.
What a complicated world. But
it's webby for sure.
But we do the best because of people like you, Laura. Laura, again, as my Director of Guest Services, I am so excited about your recent appointment to this director level position. How long have you been in this position now?
April 15th.
And prior to that, you were a manager under our previous director.
Yeah, I was. I started as a guest service rep in August 2020. So, I've been in the trenches. I know what it feels to be there. And I think that's really important to see, where we're at and where we've been, but it's a great, humbling reminder. If someone is getting overwhelmed, if we're doing this coaching, take a step back and what did I feel like when I was in those shoes to be a better leader and mentor to my team.
Well, it shows. And so it's so exciting what you're working on. We continually roll out the most advanced technology, artificial intelligence, et cetera, to make us more efficient and effective. But we're also conscious of never losing that human touch.
Absolutely.
We really want to put a lot of emphasis on that connection, in the moment connection with our patients or our guests so they feel like they're really being heard and listened to. And you do that in spades, and you and your team are just amazing. So thank you so much, Laura.
Thank you.
Yeah. Have a great day.
You too.
Image in Alaska, expert radiology, exceptional care.